The term head and neck cancer is kind of a broad term, and it refers to cancers involving the mouth or the oral cavity, the nasal cavity, and the throat, anywhere from behind the nose to behind the mouth all the way down to the voice box. And then in broader terms, it can also involve the thyroid gland, rarely the parathyroid gland, and then we deal with skin cancers involving the head and neck as well. So head and neck cancers predominantly involve adults, and with increasing age, there's an increasing incidence. So once people start getting into their 50s and 60s, we definitely see that the frequency of head and neck cancer goes up. In head and neck cancer, there are several lifestyle factors that can put people at increased risk. The biggest two lifestyle factors are smoking and alcohol abuse. So either one of those will increase a person's risk for developing head and neck cancer, but especially if a person does both of those things, then the risk of developing cancer in this area goes up pretty dramatically. One of the things that has changed about head and neck cancer over the past several years is that there's been an association with the HPV virus, or the human papilloma virus, and we've seen a higher incidence of people being afflicted with head and neck cancer at a younger age, and a lot of times those are associated with exposure to HPV. One of the difficult things about ENT in general is that we treat a wide variety of disease processes that can present in a wide variety of ways, and specifically about head and neck cancer, there are a wide variety of ways that they can present. Examples would be presenting with ear pain or throat pain or changes in your voice, and the problem is a lot of those things we associate with very normal benign processes like ear infections or laryngitis or tonsillitis. And so one of the most important things that we do is when we see people who come in with these symptoms, especially if they're hard to explain as to why they're having them, one of the most important things is making sure that they don't have some type of a cancer that's causing those symptoms. With head and neck cancer involving a wide variety of different areas, from your mouth to your throat to your voice box, by definition there's going to be a wide variety of treatments that we use depending on where the cancer is coming from. And sometimes when people have head and neck cancer, it's primarily a surgical therapy, and that's something that we take care of, treating the primary site. And then sometimes we're concerned about the cancer spreading to lymph nodes, specifically in the neck, and so sometimes we have to sample those or get imaging of those like a CAT scan or a PET scan, and sometimes we have to go in and remove those lymph nodes if there's a risk that the cancer has spread. Head and neck cancer is definitely something that we treat a lot with multimodality therapy, meaning that we refer patients to oncologists as well as radiation oncologists in the area who have a great deal of experience treating head and neck cancer as well. And again, it depends on where the cancer is coming from, which tells us which type of therapy to pursue. Cure rate for head and neck cancer is dependent, like other cancers, heavily on catching it early. And so, again, that's one of the reasons why when people come in with suspicious symptoms, one of the first things we need to do is make sure that there's not some type of a bad, malignant process going on that's causing their symptoms. And then, if it is indeed cancer, then treat it appropriately. Cure rates vary widely based on where the cancer is coming from and what stage it is. But again, the most important thing is catching it early. So I think the most important thing about head and neck cancer is just being aware that it's out there, and people don't need to get worried because they have ear pain for a few days, but if they develop symptoms that don't get better over an expected course of time, then you need further evaluation.